How is liver allocation determined on the transplant waiting list? When it comes to getting a liver transplant, the process of deciding who gets the organ first is carefully designed to be fair and based on medical need. The main tool used to prioritize patients is called the MELD score, which stands for Model 4 and stage liver disease. For children under 12, a similar system called the PELD score is used. These scores help doctors estimate how urgently a person needs a transplant by calculating the risk of death without one. The MELD score uses blood test results including bilirubin, which shows how well the liver is functioning, creatinine, which reflects kidney health, and INR, a measure of blood clotting. Recent updates to the scoring system also include albumin levels and adjustments to reduce gender disparities. The higher the MELD or PELD score, the more urgent the need for a transplant because that person has a greater chance of dying if they do not receive a new liver soon. Sometimes, patients with conditions like liver cancer may not be fully represented by these scores. In such cases, they can receive exception points, which give them higher priority. For example, patients with hepatocellular carcinoma, a common type of liver cancer, may qualify for these exception points if their tumors meet specific size and stability criteria. This ensures that patients with cancer are fairly prioritized alongside those with liver failure from other causes. Geography also plays a role in how organs are allocated. Organs are first offered locally to the most urgent candidates. If no suitable recipient is found, the organ may be shared regionally or nationally, especially for patients with very high MELD scores, such as 35 or above. This approach helps reduce the risk of death for the sickest patients by making sure they get access to organs beyond their immediate area. There are also policies in place for cases where patients need more than one organ, called multi-organ allocation. These policies help ensure fairness across different organ types and that patients who need multiple transplants are prioritized properly. The entire system is guided by ethical principles that aim to balance fairness and maximizing the overall benefit of transplants. While the MELD score focuses on urgency, ongoing research looks at ways to also consider the potential for long-term survival after the transplant. This helps improve how organs are allocated over time. In summary, liver allocation is a complex process that combines medical urgency, geographic sharing, specific criteria for cancer patients, and ethical considerations. It is designed to give the most critically ill patients the best chance of survival while making the best use of the limited number of donor livers. Patients with liver cancer are included through carefully defined exception criteria to reflect their unique clinical situations. Always remember, for personalized advice and understanding your own situation, consulting a healthcare professional is essential.